There is really big news this morning in the fight against lung cancer, which will kill, listen, more than 157,000 people in the United States this year alone. That's more than colon, breast, and prostate cancer combined. Now, for the first time, there's evidence that a simple screening test can catch lung tumors earlier, possibly reducing the number of deaths by as much as 20%. This is big news. Our Dr. Jennifer Ashton is along with the details. Good morning.
Good morning, Harry.
This is a big study, an expensive study that they literally stopped in progress because the news was so significant.
Exactly, Harry, and being called by many in the cancer world a game changer, a landmark study. This was a nationally done study. They looked at a little over 53,000 heavy smokers aged 55 to 74 years and looked at two groups, those who got a special type of CAT scan known as a spiral CT, compared that with a standard chest x-ray, found that in those patients who were screened with this special type of CT scan, they had a 20% lower risk of lung cancer death and a 7% lower risk of other causes. Potentially, Harry, we have to put this into context. Before this, there was no generally accepted screening test for lung cancer like we have with breast, colon, and prostate.
Because the problem with lung cancer is usually detected too late. It's too hard to treat. It's very, very complicated and very expensive to treat.
Exactly.
You're 80 million people smoke in the United States.
Correct.
As they're listening to this news, are they thinking, or should they be thinking, I need to get a CT scan?
Well, it's a question they need to discuss with their doctors. We also have to remember, Harry, 15% of lung cancer occurs in people who have never smoked. So this study really doesn't say anything about that group yet. We also need to remember that right now this test will not be covered by Medicare or insurance. It averages about $300, so you would have to absorb that cost on your own. And again, if this applies to you, if you have a suspicious finding on a CAT scan, you need to be followed ideally by someone who specializes in diagnosing and treating lung cancer.
And in the bottom line in all of this, all of these people who smoke, if they want to reduce the risk, they need to what?
Well, you need to never start smoking, Harry, but quitting smoking is one of the most important things you can do. And they will be doing ongoing research about what is the best type of screening. But this is a huge finding.
Dr. Jennifer Ashton, as always, thank you so much.